I'm Dr. Anthony Ruzga. I'm one of the general surgeons at Reedsburg Area Medical Center, and we are very excited to be offering treatments for chronic venous insufficiency here at RAMC. Chronic venous insufficiency is typically disease involving the veins of the legs. Veins are blood vessels that deliver blood from the tissues back to the heart. In the legs, this comes with the added challenge of transporting blood against the forces of gravity. Over time, and with repetitive stress and strain of the veins, this can lead to damage of the veins and also damage to the valves within the veins that prevent backflow of blood back to the feet. This is what we call chronic venous insufficiency. This can cause many symptoms such as swelling in the legs, as well as a sense of heaviness and tiredness throughout the course of the day and when standing for prolonged periods of time. This can also cause discomfort, cramping, tenderness in the legs, painful varicose veins. It can also cause less clear symptoms such as itchiness or restless legs. If disease is allowed to progress, this can also result in skin changes such as rashes or non-healing wounds. All of these constellation of symptoms suggest that you may have chronic venous insufficiency, and an ultrasound may be indicated to further evaluate the health of your veins in your legs. If you have any of these symptoms, it would likely be a good idea to talk with your primary care provider about ordering an ultrasound or if any further evaluation of the veins in your legs is indicated. If your ultrasound shows evidence of chronic venous insufficiency, your primary care doctor will send a referral over to my clinic. If your studies demonstrate evidence of chronic venous insufficiency, you may be a candidate for treatments to address those issues after a period of conservative therapy, which typically revolves around 6 weeks of compression therapies of the lower extremities and other interventions to address swelling in the legs. If conservative treatments are unsuccessful, you may well be a candidate for a technology called radiofrequency ablation. This is an endovenous procedure, meaning that it is minimally invasive and performed within the blood vessel through a very small incision. This procedure is typically performed through a small incision just below the knee. A small catheter and a probe are then inserted into the vein. Fluid is then injected around the vein to prevent damage to the surrounding tissues and also to prevent pain after the procedure. The heated probe is then activated and the catheter is slowly removed. During the process, the heat applied to the vein causes the vein to close down. This causes redirection of blood flow from the diseased vessels in the outside part of the legs to the deeper vessels within the legs, which are healthy. Most patients have significant improvement in their symptoms within the first 1 to 2 weeks after the procedure. Although this is not the purpose of radiofrequency ablation, most patients also notice improvement in cosmetic deformities of their legs related to veins, such as spider veins and varicose veins. If these disease processes are persistent following the procedure, there are adjunctive treatments that we can use, such as microphlebectomy and sclerotherapy, to address any residual disease that remains after the procedure. Radiofrequency ablation has a proven track record of success, and the great majority of patients have very long-lasting improvements in their quality of life after the procedure. Radiofrequency ablation is typically very well tolerated by the patient. Pain following the procedure is usually quite minimal and controlled without narcotic pain medications. Patients are typically walking immediately following the procedure and are encouraged to be active and mobile at home as they normally would, with the exception of avoiding very vigorous activity for the week following the procedure. After a week following the procedure, typically life resumes as normal and vigorous activity is not restricted. Patients are asked to wear compression stockings on the lower extremities for the first week following the procedure, but typically don't require this long term. Typically, an ultrasound is ordered several days following the procedure to make sure that the procedure was successful and also to ensure that no blood clots have developed in the deeper system of the veins of the leg. So if you are struggling with symptoms of leg swelling, achiness, heaviness, pain, or painful varicose veins, it may be worth discussing this with your primary care provider to discuss further treatment options.